let's talk about common tamoxifen side effects. I'm Dr. Eleanor Toplinski. I'm a board-certified medical oncologist specializing in the treatment of breast cancer. Tamoxifen is used to treat hormone receptor positive breast cancer. The dose for that is 20 milligrams daily. And we sometimes use tamoxifen also for benign but high-risk conditions, lobular carcinoma in situ, atypical hyperplasias. And for those, we have a dose of either 20 milligrams. We more often and increasingly are using a low dose of tamoxifen, which is 5 milligrams daily. And I have videos on that I can share. But I get asked all the time about what are some common tamoxifen side effects. So let's talk about that. Hot flashes are some of the most common things that we see along with night sweats, and that can cause fatigue, that can impact your sleep. We see mood changes. People find themselves being more irritable or more impatient on tamoxifen. You can also see symptoms of depression or anxiety, vaginal dryness or impact on libido and sexual health is something big as well. Tamoxifen, the way that it works is it works as an anti-estrogen in breast cancer cells, but almost mimics or has an estrogenic state in the uterus. And so we have that risk of uterine cancer. Now, the incidence of uterine cancer is pretty rare. It's about 1% when you take tamoxifen for 5 years. But you can also see endometrial hyperplasia or thickening of the endometrial lining, which can lead to irregular or heavy periods. We can see endometrial polyps, vaginal discharge sometimes. So any of these things do need to be worked up. And I recommend that people are regularly seeing their gynecologist while they're on tamoxifen. Tamoxifen can increase risk of blood clots and stroke. Again, a rare side effect, but we always ask about that. I ask people if they themselves have a personal history or if they have a family history, something that we need to keep in mind. Other things include fatty liver. And that doesn't happen right away on tamoxifen, but it's mostly asymptomatic. We only pick it up if people have abnormal liver enzymes, but exercise can help with fatty liver, so routinely monitoring for that. If you're premenopausal, tamoxifen can increase or worsen your bone density, so routinely checking bone density. If you're postmenopausal or you're on ovarian suppression, it can actually help with your bone density. Other things include hair thinning, cataracts, retinopathy in the eyes. Tamoxifen can also cause birth defects, so we absolutely want to make sure people on it are using an adequate form of contraception. And a question I get asked all the time is about tamoxifen and weight gain, and it can impact metabolism in some people, but not all. It can make it easier to gain weight, harder to lose weight, but that's not for everyone. And so these are the most common things and things that I talk about with patients. You may be watching this and saying, oh, I had this side effect or I had that side effect. And so this is not this is then the most common things that we see, but obviously everyone is different and everyone's going to have a slightly different reaction to it. I'd love to know what your experience has been with tamoxifen. And I think if you put it in the comments or what side effects you've had, because I think it helps other people who are maybe thinking about going on the medication or have questions about it. But the last thing I want to say is that not everyone experiences these side effects. Many people do very well on the medication. Some people may have one side effect or two. So, I don't use this list to scare you, but to point out what you can expect when you go on the medication. And I think that it is important to have these conversations. Let me know.